Welcome back to my YouTube channel, Public Health Doctor speaking. Um, I'm going to talk today about health systems, and I'll explain why. Well, actually, I was having a plan to talk about other like blocks of uh, public health, but then I decided this is the key, the health systems. Because whenever we are concerned about our health, we go to doctor, right, to medical institution. And based on our impressions of the service delivered to us, then we judge what? The health system, right? What kind of health systems are present in the world? How do we classify that? And the issue of classification is pretty critical. Um, long ago, probably in the early 1990s, I myself and my fellow colleagues in this country have experienced a collapse of the political system. And in this situation, when my country appeared to be independent, we very soon realized that the health system which existed before was no more functional. It was just in convulsions, it was dying. And we wanted to know what are the solutions? Where are we going to go? And there have been long debates among clinical doctors, among those who have been organizing healthcare system before, and most importantly among general public, among our patients. And there have been some basic keywords, so-called keywords, popping up, like private system is better. There have been many doctors, many ordinary citizens say private is better. Before we used to have a state run system, and it now turns out that it doesn't work. So private is better. Look at, say, the United States. I mean, they have much better health system than we have. The patients are happier there. There have been other keywords like, well, it's better to be for fee so that we pay, and for that particular fee we get better service, as opposed to free system where you were not supposed to pay anything. Another magic word which been appearing here or there was insurance. Well, the insurance is the key. Also, what I've been hearing lots of times, charities, charitable foundations. But in the end of the day, none of us was really having a clear uh, understanding of what we've been talking about. For instance, when we speak about private health system, is it about the money, which comes from the private sources, like you pay for the visit to your doctor? Is it about private doctors who are uh, private business people or are hired by private medical institution? So as it comes to the fee, I mean, who pays? Is it the government? Is it the charitable foundation? Is it insurance? Is that you? So therefore, in those periods of time, um, the health system leadership in my country and many other countries under the similar fate experienced, they made lots of mistakes because there was no clear structured understanding what the health system is, what the health systems are, and what are the main variables which allow us to um, classify health systems. So I'm going to jump to the next graph. These are the building blocks of any given healthcare system. That is the service delivery. In other words, who delivers that service? What kind of medical institutions are there? Okay. Is it mostly primary care? Is it about secondary care, tertiary care? How to differentiate these different tiers of healthcare delivery? Is it in public domain or private domain? Health workers, who are the people who deliver healthcare? What kind of professionals do it? Whether these are specialist doctors who have a very narrow field of specialization, or general doctors, or maybe most of the healthcare is delivered by the doctors who have incomplete medical education, or it is delivered by mostly by nurses or health workers. And we'll go back to the examples of each of these in my next videos. It's about health information. I mean, how the health, what is the bulk of the information on which the major decisions are based on? Well, in my previous video, I spoke about decision making in public health, and I also explained what is the robust and solid bulk of information on which we have to base our decisions. Medical technology. Well, the simplest, idea here is high tech or low tech. Okay? More expensive, more specialized medical equipment, or more general equipment which allows us to treat and diagnose, the clinical cases at a lower price and to reach the largest number of people. Leadership and governance. How these health systems are governed. Is it just a strict top-down management at the level of the government, or it is about just setting up the rules of the game, like some caps, some ceilings, or like the lowest allowable standards of care, and so on and so forth. And the last building block is health financing. I have a very confident opinion that out of these 6 very important building blocks of any given health system, health financing is the most important. In other words, the basic question here is where the money comes from, okay? Or who pays? Because there is no free healthcare. I'm absolutely sure, based on my experience and knowledge, that there is no free healthcare. Healthcare is quite an expensive commodity, and someone should pay. Okay? The question is who pays, how this money comes to the health system, and the other question is how this money is being spent. Okay? Now, the good news is that there are very few sources of money, which therefore, a little bit more facilitates for us the classification process. Well, the first and foremost is it's taxes, right? When the governments collect taxes, like the general taxes like income tax or value-added tax or customs duties, social, whatever, kinds of different taxes, all those taxes get together in the state budget, okay? And then the governments decide how to spend this money. Certain amount of money goes to education, the other, amount goes to agriculture, defense, and healthcare. So, in other words, the one source of money is taxes, general taxation. What are the other possibilities, other sources of money? Insurance. Now, insurance in general is a agreement between the large numbers of citizens that they pay certain monthly or annual fee, which is fixed, and whenever they need, they can use this money to reimburse the healthcare services. Okay, that's the solidarity principle, which lies under and the basement of all insurance systems, whether it's health insurance or property insurance or malpractice insurance or car insurance, whatever. Okay, or social insurance. We pay all, and those who are in need then they use this money to cover the services they want to be covered. Now, within this, source of money, there are three major kinds of insurance. Private voluntary insurance. Private in general means that the insurance is delivered by the private insurance company, right? Which by itself might be for profit. Most of the private insurance companies are for profit. They make the profit. They're profitable business entities. And in few examples, there are private not-for-profit. So a good example is the United Kingdom. But it's a long story. I'm going to talk about that in my later videos. So therefore, we got private voluntary insurance. What means the word voluntary? That I, a citizen, decide whether to buy that insurance or not. Okay? Sometimes private insurance is mandatory, and there are countries where certain groups of people, certain groups of citizens, based on their income, are required to buy private insurance. Otherwise, they're going to pay fines. Okay, so that's mandatory. The other kind of mandatory insurance is private employer-based insurance, and the good example is the United States of America. When you start working with a large employer with several thousands or tens of thousands of employees, normally they have the insurance contracts with one of the insurance companies. When they buy the bulk insurance contracts or the insurance policies, so the insurance companies then effectively reduce the price. Okay, so and that's and you as a future employee, when you're about to sign the employment contract, they tell you, okay, everything is fine, but you have to also take a responsibility over buying our insurance. If you don't buy the insurance, we're not going to sign a contract with you. Okay? That's a private employer-based insurance. I'm also going to talk about that later on. And the third one is social insurance. It is kind of it's mandatory by its nature. Most of the time, social insurance is not for profit, and it happens in the public domain. And a good example is Germany, where the social insurance as such was born in the end of the 19th century. Well, what is the social insurance? That the people, the citizens, are obliged to pay a certain amount of money or certain share of their income on a monthly basis to the insurance companies, which is not for profit, and the company by itself is not private, it's public, whether it's company or insurance fund or whatever name. And then whenever you need healthcare, so this insurance company or fund reimburses your expenses, of course within certain limits. So therefore, insurance is the second source of money, and the third source, which has a rather limited share out of all other sources, is charities. Okay, charitable money. In all countries, you might hear that especially refers to rare diseases, treatment of which is really expensive, that some private companies or crowdfunding instruments provided funding for a particular disease for particular patients. And last but not least is out-of-pocket payments, or when you pay to your doctor or to your healthcare provider directly. Okay, so therefore we can classify health systems based on these sources of money. And of course, many healthcare systems in the world use different combination of these sources, or they are the mixed systems. I think I provided the basic explanation how health systems can be classified. So in the next couple of videos, we'll talk more about the specifics of each of these types of systems. So that was it for today. Thank you. I will see you soon. So in the meanwhile, please stay in good health. Bye-bye.